The world's largest ever outbreak of the disease has killed more than 3,800 people in Guinea, Liberia and Sierra Leone. And the death toll, well, that just keeps climbing. Liberia's health ministry reports that 75% of those infected or killed by Ebola are women. UNICEF's Chief of Crisis Communications, Sarah Crowe, has first-hand knowledge of the ongoing plight of women and children in Liberia. She returned from there recently, and I'm pleased to say she joins us now from our New York studio. Sarah, thank you so much for joining us. As we just laid out for our viewers, this disease is affecting women and children disproportionately. You've seen the situation firsthand on the ground. Give our viewers some sense of the scale of the problem.
Well, it's really hard to exaggerate the scale of the problem. Ebola has effectively hijacked every single aspect of life. The schools are closed and will remain closed at the least until January next year. Health facilities are entirely overwhelmed, as you've seen. And then, in ordinary circumstances, primary health care should be functioning, but it is not. So we're fighting a battle effectively on two fronts. On the one hand, it's primary health care, which means that children are not getting the immunization they need, the vaccines they need. Pregnant women are being turned away or indeed dying in childbirth. Just a few days ago, before I left Liberia, I met a pregnant woman who had she had lost her baby because she'd been turned away from health facilities. Another colleague's relative, in fact, had lost her own life in childbirth. This is the scale of it. And Liberia had actually started to make some very significant decline, for instance, in child mortality. So we're seeing this eroding every aspect, and we have to move on this parallel track and keep our eyes on these two battles at the same time.
Yeah, you're absolutely right. This is a battle that has to be fought on multiple fronts. Of great concern are the number of children. We want to talk about the children who've been orphaned by this outbreak and then who've gone on to be rejected by other family members and in some cases the wider community. Sarah, talk to me about this. Who is caring for these children now?
Well, it's very sad to see, because even in good times, you spoke earlier about the HIV and AIDS crisis, and in the early days in Southern Africa in particular, you had this network of grandmothers who were looking after children, aunties who were looking after children who were AIDS orphans. Now, with the Ebola epidemic, this is really eroding that sort of sense of compassion, that natural sense of human instinct to take care of the most vulnerable of children. But what we are doing, together with the Ministry of Health and Social Welfare in Liberia, is setting up a system of interim care centres where children who are particularly vulnerable in that 21-day incubation period, if they've been exposed to members of their family or others in their community who have had and contracted Ebola, that they're taken care of by survivors who have a level of immunity that means that they can give that sort of human care and touch and nurturing. And this is really critical. On the other hand, we're seeing emergency foster care systems kicking in amongst survivors as well. But there is good news, and it's important to focus on that. A number of children in one centre that we supported have been reunited with extended family members. So this is ongoing.
It is ongoing, and it is fantastic that you're putting the protocols in place, you're putting the systems in place for these children to get some care and in some cases be reunited with family. But let me ask you this, as you look at the situation, which is ongoing, it is getting worse, what is your greatest concern?
Well, I think, as you already heard earlier, we know that having seen the sort of scale and scope of the Ebola epidemic, which is truly extraordinary, of historic proportions, it requires an extraordinary measures, and we're not yet seeing that. So if we did start to see some 2 weeks ago in Liberia the sense that the world had not abandoned Liberians, but we're not seeing enough support, we're not seeing enough attention, and the only way to stop it spreading elsewhere is to support the efforts on the ground. So the biggest fear is that you will have children dying from preventable diseases, which would be an absolute outrage in the face of this historic epidemic, and we have to keep our eyes on both of those battles at the same time.